Millions of Americans suffer from severe underbites, overbites, and other serious jaw and facial problems. But many are finding out they no longer have to suffer in silence. Sheila Steinbeck joins me now with a special report on dental deformities. Sheila.
Hi, Jan. Well, we've met several young adults who've had these dental deformities. They avoid interacting with friends. They couldn't choose certain foods. They didn't do something we all take for granted, smile. But that all changed when they met a doctor who said he could help.
You look at everybody else and you're wondering, why me? Why do I have to go through this?
It lowered my self-esteem. I cried and prayed that one day I would just wake up and it would be all better.
For Carmen Inoa and Ladita Smith, growing up wasn't easy. They both had a dental deformity. Ladita had a severe overbite and an underdeveloped chin, which made it difficult for her to close her mouth. Carmen had the reverse problem, a severe underbite, which gave the middle of her face a flat appearance and her lower jaw protruded outward. Both did not want to smile. They were afraid their deformity would become more noticeable.
I was always really uncomfortable and just aware of my face and the way I looked and the way people were looking at me.
Carmen and Ladita pretty much kept to themselves. They didn't mingle with a lot of other people. They were afraid that folks would stare at their mouths, make fun of them. But that was before they were introduced to the doctors here at NYU's Dental Center.
What we really try to do is take care of the abnormal appearance and make people look normal.
Dr. Stuart is a facial reconstruction specialist at NYU Dental Center.
Right about here, right there, right where my instruction is, right there.
He has performed hundreds of operations to correct dental deformities, many for no charge at all.
These kids, or these adolescents or young adults, are not normal looking to their peers or to the kids in school or to some of the people they work with. So it has a big impact on them, both, I think, emotionally and psychologically in many cases.
Carmen and Ladita both had their corrective surgery performed by Dr. Super. The changes had its physical benefits, but the emotional impact was much more dramatic.
Do people comment on your smile now?
Yeah, I've noticed that a lot. Before I didn't notice it, but people do say that I have a nice smile.
Yeah, how do you feel about that?
I think it's pretty good. No one would have said that before.
I don't think you're ever going to have to worry about it. You can truly look at someone and smile and say, I feel good about what you're seeing.
Both women are now outgoing, meeting new people, and easily striking up relationships. Changes that have not gone unnoticed by their friends.
She smiles a lot more. Like I don't think she realizes it, but she'll smile just randomly in the hallway when she sees you.
She has changed, like as far as being around other people. You know, before she'd be like, well, I don't want to go there. I don't want to be around them. But now she doesn't have no problem with being around anybody.
I'm happy with it. At first I was scared. My face was this big, and I didn't know it was me for the first month or so, but now that the swelling's gone down and everything, I'm like, I like it.
You can see how pretty they both are. We're happy to report that Carmen and Ladita are doing well. Carmen starts Princeton University in the fall, and Ladita begins her third year at Clark University. That's down in Atlanta, Janice.
They are quite some ladies there with fabulous smiles. That's
Yeah.
just a great, great story. But is it expensive?
Oh, it's very expensive. It's $30,000 to have this procedure. Now, Carmen did get some state assistance for hers, and Ladita, hers came from a grant from the college. So you should check with your local dental school to see if there's some assistance you can get in having this done, because it is extensive.
But they're living with the results, and they're absolutely loving it.
Absolutely, yeah.
Totally change their personalities?
Yeah, we take it for granted what happens. And it really can affect your life, particularly when you're a young person, and that's all you want to do is interact and have fun. But you second guess yourself when you think that your mouth or your smile doesn't look that attractive.
Very enlightening report.
Yeah.
Thank you, Sheila. And dental deformities don't just happen to women. After the break, Sheila will be back with part 2 of our story. We'll meet a young man who also suffered from a disfiguring problem. Hi everyone, I'm Janice Lieberman. Welcome back to the best of Steals and Deals. Getting through the teen years isn't easy, especially if you have a physical problem like obesity, acne, or a dental deformity. Kids can be cruel to one another. One young man's struggle to look normal is the subject of part 2 of Sheila Steinbeck's report on dental deformities. Sheila?
Janice, for the millions of people who are suffering from dental deformities, life can be cruel. The physical problems also have a psychological impact. Many withdraw from social situations and avoid smiling because they're embarrassed of their appearance. But a surgical procedure can provide relief.
Okay.
When we first met John Kando, it was a week before he was about to have an operation on his face, an operation he hoped would change his life.
Are the kids pretty nice?
John has a dental deformity, a pronounced underbite, and a crooked jaw. It's caused physical problems as well as some emotional scars.
It must be very difficult.
Well, first of all, it's been intimidating for me to talk to the people, laugh, smile. It was hard enough when I had my teeth weren't straight, and it was embarrassing, and it made it more embarrassing having a big overbite.
John grew up as a healthy and normal child, but around the age of 12, he noticed some changes to his mouth. He was very self-conscious of his deformity, and he withdrew from social situations, hiding his smile. John recently started college, but wasn't meeting new people and making friends. He said he bottled up his sense of humor. The physical problem made him avoid foods he had difficulty chewing, like pizza. The foods John could chew had to be carefully maneuvered around his mouth. John thought he would have to live with this problem. An operation would be too expensive. But that was before he met Dr. Stuart Super here at New York University's Dental Center.
John's problem is dramatic in that I think he was really affected by it, very much so by his underbite. I think he was embarrassed by it. He always wanted to have something done. He never thought he could have anything done.
Have you thought about some of the things you'll do that you don't do right now?
Smile more often, yeah, to people.
We went to the hospital the day of the operation, a day John thought would never come.
How are you feeling right now? You're a few minutes away from going into surgery.
A little nervous. Waited too long already. Wanted to get it over with.
Okay. Finally, after years of waiting, after years of enduring pain, discomfort, inconvenience, and even ridicule, John is just moments away from the operation that he believes will change his life forever.
Okay, get a retractor up here.
The operation lasted more than 4 hours. Dr. Super moved John's upper jaw forward, his lower jaw back, and aligned them so they would no longer be crooked. Dr. Super said the operation went very well.
Somebody hold this down. Hold this down.
John will probably notice over a period of time a speech improvement, eating improvement, and hopefully emotionally he'll feel better over the next months and years.
We met with John several months after the operation. Comparing John's physical appearance before the surgery to how he looked after was dramatic. We also noticed a change in his confidence.
The operation has given me a big change. First of all, let's see, physically, I have a new appearance, and I like it now.
John can now eat any food he wants, and he can do something he avoided for so many years: smile. John realized that all this could not have happened without the help of Dr. Super.
Open, you are.
I would just like to thank him for all the thanks I could give him. He's the man who changed my bite, and it's changed my life.
Oh, gosh, doesn't he look different? He continues to do well, John does. He says he's finally letting out of his sense of humor, and he's becoming more sociable, and he's meeting many new people, Janice.
He was brave to do it, but boy, does he look great.
Right. Did you see the difference in when we first started talking to him? He was a bit hesitant, and now he's just, you know, a regular pundit.
Right. How did he afford this? Because you said it's very expensive.
Yes, it's $25,000. He was able to receive some financial aid for his. And again, we just urge people to check with your state aid and to check with the local dental schools, because sometimes this is the way people are going to learn how to do these. And to do it for people who really need and deserve to have this happen for them.
As these people do.
Yeah.
Sheila, thanks for that two-parter. Great.
Thanks.
Has this happened to you?